Okay, the next topic we are going to talk about is cardiac output. Cardiac output basically it is the amount of blood that comes out of the heart every single time the heart pumps. The cardiac output is depending of two variables, heart rate and stroke volume. Heart rate is how many times your heart is going to pump the blood per minute. And the stroke volume is the volume the left ventricle pumps out. So then cardiac output, stroke volume times heart rate. You have in here resting values, the heart rate, 75 beats per minute. The stroke volume is approximately 70 milliliters per beat. So that means that you're going to pump approximately 5,250 milliliters per minute, which is approximately 4 to 6 liters. Now, what factors are going to affect the heart rate? The heart rate, we said, is approximately 70 to 80 times per minute. And then if your heart beats faster, then we are going to call that tachycardia. And the heart beats slower, we are going to call that bradycardia. What can produce tachycardia and bradycardia? Well, it depends. For example, if you're in love, your heart beats faster, right? Okay, and those things are controlled by what? By your brain. What part of your brain? The autonomic nervous system. And that's why it says in here, chronotropic effects of the autonomic nervous system. We know that the autonomic nervous system is divided basically in sympathetic and parasympathetic. Sympathetic is faster, parasympathetic is going to be slower. So when your heart is beating faster, is because the sympathetic is making your heart rate increase. And when your heart is beating slower, then it's going to be the parasympathetic through the vagus nerve. So then what else affects the heart rate? We also have the receptors. For example, we have proprioceptors, baroreceptors. Proprioceptors are the ones that you're going to find in your muscles as well as joints, and they provide information to your brain regarding the physical activity that you're going to perform. Therefore, the heart rate can increase the output depending on the physical activity that you're going to perform. Baroreceptors, baro means pressure. These receptors at the level of your blood vessels are going to control the pressure that you have in the aorta as well as in the internal carotid. And this is going to send information to your brain, and your brain obviously is going to decide whether to increase or decrease the stimulus. Other receptors that we have that will affect the heart rate are chemoreceptors. Chemo obviously sounds like chemistry because there's quite a few substances in your blood that are going to be captured by these chemoreceptors and send information to your brain, because these chemicals are going to affect how the heart rate is going to be. So for example, they are very sensitive to changes in the levels of oxygen as well as carbon dioxide. Carbon dioxide is related to the pH, so also changes in pH will affect the heart rate. Other chemicals that are very important, potassium as well as calcium. Right here you have, as I was telling you, potassium, also calcium. So then we have the stroke volume. There are three factors that affect stroke volume. One of them is the preload. This means before the heart. This means the blood that gets into your heart. If you scroll down, you're going to see contractility, because the other factor is the heart itself, the muscle, the myocardium. And the next one that you're going to have that affects the stroke volume, if one of them is the preload, then guess what the next one is going to be? The other one is afterload. That means the blood after your heart. So any factor that affects the amount of blood that gets into your heart, basically the preload, then will affect the stroke volume. Let's imagine that you have the vena cava, right? The vena cava basically is the one that returns the blood to your heart. So imagine that the vena cava is supposed to return 5 liters of blood, and for whatever reason, the vena cava returns only 2 liters of blood instead of 5. So then that means that the heart gets less blood. Therefore, the stroke volume is going to be less because your heart is receiving less blood. Contractility. In this case, let's assume that the vena cava returns 5 liters to the heart. Okay, but what happens if you actually have a heart attack? Then your whole entire heart is not working properly because you have a heart attack. So therefore, if you receive 5 liters and you have a heart attack, do you think that your heart is going to be able to pump the 5 liters? No, the contractility will be affected because since you have a heart attack, then the heart attack will damage the muscle, in other words, the myocardium, and therefore your heart will not be able to pump the 5 liters of blood. So then obviously contractility also affects the stroke volume. So then if we scroll down, the afterload. Imagine that we have the 5 liters in the heart, so the preload was perfect. The heart has no problems, so it's going to be able to pump all the 5 liters, and the blood will come out of your heart using the aorta. Imagine that for whatever reason, the valves in the aorta are thick and they don't open properly. So even though your heart is producing all the pressure they're supposed to produce in order to pump the blood, not all the blood will come out into your body because the valves in the aorta are very hard, therefore they don't allow the blood to go through it completely. Since that happens after the heart, then the name for that is going to be the afterload. Then the factors that affect the stroke volume are going to be the preload, contractility, as well as afterload. Exercise and cardiac output, obviously, it doesn't come as a surprise to anybody that if you exercise, the cardiac output will increase, right? The stroke volume will be higher, and the heart rate, your heart is going to beat faster. So obviously, the cardiac output is going to be higher. So when you exercise, you have a higher cardiac output. Table 19.1 shows you some of the agents, chemicals, for example, that will affect cardiac output.